Psychiatric question 4. 17. A client with a diagnosis of depression has been meeting with the mental health nurse for therapy section for past 6 weeks. During the section, the nurse says, "The nurse, I lost my job this week and I am going to be vacated from my apartment if I cannot pay my bill. The only person that I have is my daughter, but I don't want to burden her with my problems." Which response by the nurse would be most therapeutic? 1. If you get vacated from your apartment, we will commit you to the hospital so you will have place to eat and sleep. 2. Why did you lose your job? 3. There are homeless shelter available and we will get you into the one of your vacated from your apartment. 4. Let's talk about your contacting your daughter. Would not you what you know if your daughter was difficulty and try to help her if you could. The correct answer is 4. Let's talk about contacting your daughter. Would not want to know if your daughter was having difficulty and try to help her if you could. 18. During the therapy session for the client with paranoid disorder, the client says to the nurse, "You look so nice. I have love you to your hair and I love that perfume that you are wearing." Which response by the nurse would be the most therapeutic? 1. Thank you noticing, I just bought this new perfume. 2. My hair has been mess. I really needed to have it done. 3. Your comment is inappropriate. 4. We are not here to discuss how I look or smell. We are here to talk about you. The correct answer is 4. We are not here to discuss how I look or smell. We are here to talk about you. 19. A monoamine oxidase inhibitor is prescribed for a client. The nurse instructs the client that which of the following is a sign or symptoms of toxicity related to the use of this medication. 1. Restlessness. 2. Feeling of fatigue. 3. Lack of energy. 4. Lethargy. Correct answer is restlessness. 20. A nurse in the mental health unit is assigned to care for a client with a diagnosis of acute depression. In communicating with her client, which of the following statement would be most appropriate for the nurse to make? 1. You will feel better when your medication starts to work. 2. Don't worry, everyone gets depressed once in a while. 3. You look lovely today. 4. You are wearing a new blouse. Correct answer is 4. You are wearing a new blouse. 21. A nurse is planning for a care of client with bipolar disorder who is experiencing psychomotor agitation. Which of the following activities would the nurse plan for this client? 1. Reading letters and books and quiet environment. 2. Involving the client card game with other clients on the unit. 3. Providing activities such as seekers from the client. 4. Including the client clay molding class that is scheduled for today. Correct answer is 4. Include the client in a clay molding class that is scheduled for today. 22. A nurse is reviewing the plan of care for a client with a diagnosis of depression. The nurse notes that the client diagnosis of altered nutrition less than body requirement is documented on the plan of care. Which of the following would not be common for the plan of care diagnosed to improve the client's nutrition? 1. Allow the client to eat alone in the room if client requests to do so. 2. Assist the client in selecting foods from the food menu. 3. Offer small, high-calorie, high-protein snacks during the day and evening. 4. Offer high-calorie foods throughout the day and evening. The correct answer is 1. Allow the client to eat alone in the room if the client requests to do so.